Upon opening a patient chart, multiple menu items will be available. The menu can be seen to the far left side of the screen. Each menu section contains specific patient information. To move from one area of the chart to another, simply click on the different menu names. Also, every chart has a header, often referred to as the banner bar. The banner bar contains many demographic elements and key clinical data details. Some information in the banner are encounter specific, such as the FIN, admission dates, and locations. Other elements may cross encounters, such as demographics and allergies. If the user desires to have more space in the viewing screen, the menu pushpin can be unpinned. This allows the menu to hide until needed. Moving the cursor over the word menu reopens the menu list. For this video, we'll repin the menu. The Orders section contains 3 tabs: Orders, Medication List, and Document and Plan. The Orders tab allows users to see all of the orders and order sets placed on a patient for the specific visit. The Orders tab includes the View pane, where the order categories can be seen, and the Orders Profile pane, where the specific orders and their details can be seen. The orders which are displayed in the pane are contingent on the filter criteria defined above the pane. To change the order's filter criteria, click on the hyperlink at the top of the profile. Choose one of the pre-built sentences that best fits your needs, and click Apply. The medication history documentation and reconciliation history can also be seen in the Orders tab. The Medication List tab on the Orders page shows all medication orders for a patient. The Med List contains prescriptions and documented home medications, which are not seen on the Orders tab. The default filter is to display all active medications. The filter seen at the top of the profile pane can be changed if inactive orders are needing to be seen. The Document and Plan tab includes such things as interdisciplinary plans of care and nursing plans such as fall prevention plans. The Medication List menu item contains all of the same areas and contents as the one that is seen on the Orders menu section. The only difference is that if you choose the Medication List menu item, the initial focus will be on the medication list instead of the Orders tab. The Allergies tab also includes the documented allergies for the patient. This tab can also be filtered by using the drop-down menu and choosing between all, active, or inactive. The Diagnosis and Problems tabs includes all of the documented problems and diagnosis for the patient. The diagnosis should be encounter specific and the problems cross encounters. You can filter either one by choosing the drop-down menu and selecting all, active, or inactive. The Histories section includes multiple history tabs. The Family History tab includes health history, both positive and negative, for the patient's relatives. This tab can be filtered by using the drop-down menu. The Procedure History includes codified procedure information. The Social History includes information documented as a part of the patient intake process regarding pertinent environmental factors and lifestyle activities. The MAR Summary menu section provides a concise view of the medication administrations and scheduled administrations. The view is set to display all active medications. This can be changed by selecting a different option from the drop-down menu. The MAR Summary view is defaulted to view in 8-hour blocks and look 2 days back and 1 day forward. These properties can be altered by right-clicking in the long gray time bar and choosing Change Properties. The Results Review menu section provides a quick place to view results from multiple types of documented data. Most tabs are self-explanatory as to what they contain, such as Labs 7 days contains labs for the last 7 days. Recent Results tab looks back for a clinical range of 48 hours for a wide range of result types. Each tab is pre-built to retrieve a specific set of result types for a specific time period. Many nursing and ancillary results can be found in the Assessments view, and the default time frame is 7 days back. If the time period desired is not contained in the default range for a tab, right-click on the long gray time frame bar and choose Change Search Criteria. You can choose between a definable clinical range, a result posting range, a result count and years to look back, or admission to current. Keep in mind that the results may take a significant time to load if a large amount of results are included in the time range selected. Menu result tabs can be viewed as a table, a group, or a list by changing the selected radio button. The Lab 7 Days, Lab 18 Months, Diagnostics, and Vital Signs tabs all share the same structure and view options discussed with the Recent Results and Assessments view. The Microbiology tab is a bit different. The section retrieves microbiology orders and results and antibiotic orders from the patient's chart based on a defined date range. There's a drop-down option that allows the user to change how the information is sorted. The Patient Information menu contains 3 tabs: Demographics, Visit List, and a PPR Summary. Demographics tab contains information specific to the patient and not the encounter, such as vital statistics, addresses, phone numbers, and account numbers. The Visit List tab contains encounter-specific information. The upper window lists all the registered visit encounters. The lower window includes the encounter-specific information. The user can change the encounter to be viewed by double-clicking on the desired encounter. A pop-up warning will display when attempting to change encounters. Changing the encounter within the visit list will change the encounter being viewed and acted on for all the chart sections. The PPR Summary section identifies all patient-provider relationships which have been established with this patient. This section looks at all visit encounters for the patient. Every user who has associated a relationship with the patient chart will be listed in these panes. Both lifetime and visit relationships are displayed. The Immunization Schedule menu section includes a display for CDC recommended immunizations. The upper grid display will vary depending on the patient age. Previous immunizations will display in the lower left. This area contains both historically documented and system-ordered and administered administrations. Future immunizations will display in the lower right. This area displays immunizations with due dates based on the defined schedule for the patient's age. The Health Maintenance section helps proactively set and address the healthcare needs related to a patient's long-term health. Some expectations will automatically appear, such as screenings and vaccinations. Some appear related to active medication orders in the patient's chart. Others are initiated manually by the provider. The Notes menu contains all of the documents created for the patient. Many sorting options and filters are available for this menu item. Go to the Viewing Patient Chart Documents video for instructions. Documentation menu contains all of the chart's documents also found in the Notes menu, but has different filter options available. For filtering instructions, please see the Viewing Patient Chart Documents video. Provider charts usually have 2 different workflow tabs. Sometimes they're called summaries. There's usually an acute and an ambulatory. The variations between them are primarily values that they're looking back to find. Each page is brought together with several different subsections that have a criteria designed to bring in pieces of the chart into a very concise view for easy interpretation by the provider. Not every workflow page has the same tabs, and not every workflow page has the same lookbacks. They customize these pages based on the provider's specialty. If you're looking at vital signs on one workflow compared to another, the primary difference will be the amount of lookback and whether it crosses encounters or not. See the workflow video for information on customization. The VCH Custom tab provides access to the Via Christi Clinical Archives. If the patient had visits from before June of 2014, a list of these visits would be visible. Users can select a displayed visit to access the archived information from that visit. The Learning Live section is not a part of the actual patient chart. This section provides links to helpful hints, videos, and other information to help with questions about how to utilize one chart. The Discharge Care Management Summary provides a way to see information created or utilized by the case managers. Providers do not act on anything in this section of the chart. This section can provide helpful information about the patient's discharge management. The patient's assigned case manager or social worker can be seen here as well. The face sheet section allows front-end printing of face sheets. The face sheet is primarily used to provide information to the front office staff for billing-related purposes. The Flowsheet and I&O section contain intake and output documentation, a physician's view of nurses' documentation, and a graphing section. The default range for intake and output in your flow sheets is defined by the system, but if you want to alter that, right-click on the gray bar and change the display settings. Choose Other from the drop-down option. When you're looking at the intake and output, you could see column totals, hourly totals, daily totals, as well as each individual line item that was documented on. The Advanced Graphing section will allow you to graph various numeric results from the patient's chart. Some graphs are predefined for you, but you can create your own. Some providers also have mother-baby specific sections. The Pregnancy Summary is an M-page which provides some cross-encounter information for OB-specific data points and the hyperlink interactivity with other parts of the chart. The OB Summary is a report-style section which pulls specific data together from multiple parts of the chart. You do not chart within the OB Summary, it simply retrieves information. The Delivery Record is a flowsheet view of defined data points which come from the nursing documentation. Neonate Summary is an M-page for use in viewing neonate information when in the neonate's chart. The Growth Chart section contains pediatric CDC, Fenton, and Down syndrome plotting graphs using the system charted data points. The charts display the previously documented data plot points. There are multiple age range options for the growth charts. The system displays the one closest to the age and sex of the patient chosen. All the growth charts are pediatric charts, but will still be viewable on adult patients. Remember, when viewing a patient's chart, depending on the age, sex, and reason for visit, some chart sections would not apply to the patient or encounter being viewed. If that is the case, simply ignore the section.